Welcome to DuvaSawko. I'm Valentina, software engineer at DuvaSawko. You may accompany me on a tour of all that DuvaSawko does to help you efficiently and quickly manage your practice. Or you can simply click on one of the pages to read about the DuvaSawko difference. Let's start our tour. First, I would like to introduce you to the founders of DuvaSawko. First, Dr. Duva. As the CEO of DuvaSawko, why is DuvaSawko the premier practice management, coding and billing firm for emergency physicians?
Well, DuvaSawko was created out of need. As you know, Valentina, we're emergency department physicians. Our ED physician practice M-Pros had hired numerous billing and management consultants over the years, and none delivered on their promises. In fact, the last company we used nearly bankrupted our physician group. So a partner in our group, Dr. Bill Sawko, and I started DuvaSawko to initially manage and bill for our own ED group. Once we spent the time and resources to develop the important tools necessary to properly manage our own group and successfully collect revenues, we are asked by other ED practices to help them. Now, many years later, we are known as a nationwide leader of our ED billing, coding, and practice management services. We've helped most groups significantly increase their revenues, and we look at everything. We consider their contracts with the hospital, fee schedules, staffing, documentation, and of course the coding and billing. Dr. Sawko and I have been helping practices collect more revenue for years. The very important information gathering technique is what we like to call the DuvaSawko difference.
Okay, next is Dr. Sawko, our Vice President and Chief Information Officer. Hi there, Dr. Sawko. We are telling people about the DuvaSawko difference. Can you tell us about Practice Monitor and how that benefits our customers?
Practice Monitor is the front end, meaning the part that the user sees, to our comprehensive business intelligence platform. With it, our users can instantly view the near real-time status of a number of measures, such as visit count, procedure count, charges, payments, adjustments, RVUs, and turnaround times, plotted or filtered by various attributes, such as time, cost center, payer, provider, procedure code, and even clinical conditions like patient age, non-traumatic chest pain, syncope, stroke, and community-acquired bacterial pneumonia. This clear and easy-to-use front end is connected to a powerful analytical server on the back end. Every evening, data is extracted from our transactional database, cleansed, and loaded into our data warehouse. Now, the Practice Monitor behind the scenes actually submits multi-dimensional queries to the analytical server, which are processed up to 1,000 times faster than traditional relational queries.
Do we ever make recommendations to our clients based on our review of their data?
Oh, absolutely we do. At least once a month, or more frequently as needed, our managers check certain key performance indicators and note any trend outliers, which they then communicate back to their lead physician so that they can make better business decisions about their practices. That's our job, to help our clients get paid for every bit of work they do and to help them manage their practice more effectively. As former ED physicians ourselves, we understand that both the reimbursement and the clinical environments are only getting more and more difficult. Physicians need a trustworthy partner to count on, and we're more than happy to fulfill that role.
This is Jill Reynolds, the Chief Operating Officer for DuvaSawko. We are helping folks understand the DuvaSawko difference. Jill, what can you tell us?
I think the most important thing I can share is, at DuvaSawko, we pay attention to details other companies don't, and those details translate into significant reimbursement dollars for our clients.
Now that you have been introduced to the principles of DuvaSawko, and they have explained the DuvaSawko difference, we're going to follow the comprehensive process of how a patient visit in the emergency department becomes a claim and ultimately a payment in your physician group's bank account. When you, the ED physician, see a patient, it's up to you to document every detail of the visit. This is one of the most important components in you getting paid properly and promptly. Within a few days of this patient encounter, DuvaSawko will receive the patient chart and demographic data to create a claim. It depends upon the hospital as to the format we receive data. It can be paper or electronic. Next, at DuvaSawko, we have an audit process that ensures we actually receive a chart for every patient you saw on a particular day. The claim then proceeds to our coding department, where the documentation is reviewed by certified coders, many who are former nurses, that will affix the proper medical codes to all of the work you performed in the ED.
As Coding and Compliance Manager, it's my job to make sure our coding is precise. We also make sure the many regulatory measures that can trip up our client physicians are strictly adhered to. We provide your physicians with feedback to help them improve their documentation and appeal every denial issued by insurance companies.
After a claim is submitted to the insurance company or other payer, we must await payment, which can take 10 to 45 days. Sometimes a carrier will deny payment, and it is our job to appeal any denial on your behalf. We have a nearly 99% rate of overturning denials by insurance companies. Once the payment comes to us, your dedicated account team posts the payment to your account and ensures that your practice is receiving the proper payment for the claim filed based on your group's individual fee schedule. So, you can see there is a lot that goes into creating a clean claim, one that you can count on being paid. Our job is to take the worries out of you doing your job as a physician. You can count on DuvaSawko to pursue every dollar just like it was our own. And as your trusted partner, we will give you the advice you need to manage your practice better. If you want to put our experts and our proven process to work for you, email us at businessdevelopment@duvasawko.com. We will conduct a complimentary analysis of your practice so you can learn just what we can do for you.